So I think the take-home points of the cholesterol guidelines are really three things. Number one is that it's very clear that statins are still kind of the mainstay of therapy. For people that have elevated risk for cardiovascular disease, lowering their bad cholesterol lowers the risk, and a statin is probably the best way to do that. We have good evidence that they work well, they're very inexpensive, and we have good evidence for safety. The second point is that despite all the evidence for safety, we have a lot of people that still don't tolerate statins, and now the guidelines kind of give a clear framework for who should consider additional therapy. So we have two other classes of medication which have shown to be a benefit, and we have now a pretty clear guideline laying out how we should use them. And then thirdly, there's a lot of people who are uncertain about taking these medications. We now have a pretty clear guideline for who should undergo a calcium score and who shouldn't. This is a test that's been around for a while, and we've had a lot of studies that looked into what its value potentially could be, and now the guidelines have finally accepted that and shown that for people that are at intermediate risk, it's a very reasonable test to undergo to understand your 10-year risk for a heart attack or stroke in the near future.